All right, welcome to our special therapy session with Chiranda Jojo. Uh, Jojo is a spastic cerebral patient. We have had him inpatient with us for a very long period of time. So we usually have the soft tissue manipulations, then we go to the passive joint range of motion, and today I'm going to be able to take you through some of the few of the exercises that we actually do with him on the mat, and then also go to the other exercises that we do with the other assistive devices that we do have within the department. So there is limited range of motion in both his in both his knee joints. So we usually first start with soft flexion exercises, be able to lock down his knee, and then we're able to move clearly and see that we finish off the range of motion. Just softly, don't apply pressure. Jojo, is it paining? It's paining. It's going to stop paining. Yes, so we do this soft, these joint range of motion exercises. You can do like 25 reps. Then from there, you're unlocking this knee joint. However, with Jojo, he does have contractures present, so it's that's why he is not having the full range of motion completing at the lower limb, at the knee joint. Come to this other limb, you're still going to do the same exercises you have been doing for this limb. You can be able to move through the hip joint as well. We start usually with the ankle joint, move to the knee joint, and then to the hip joint. So you move joint by joint, doing all the different movements to see that you get through the passive joint range of motion without him actually doing it by himself. However, away from the lower limbs, Jojo, can you sit? Sit. Let us sit. Once he's fully sat, you can still be able to get range of motion exercises, passive range of motion exercises with his upper limbs. So you start with a full arm, that is from the shoulder joint. You do the different movements in all directions, fully finishing up. However much for Jojo is difficult because of the present contractures, like I said earlier, in most of his joints due to the spasticity, the muscle spasticity. So you still do this range of motion exercises for most of the children. Those that do have the full range of motion, finishing up straight, then you still move to the hyperextension. You do the flexion from the elbow joint. That is when you've now moved to the elbow joint, and then the same at the wrist joint. So at the wrist joint, for Jojo, we're trying to see how much you can make his hands functional, engaging him in much more of functional activity. So more so using his hands. So that is looking at fine motor, bilateral hand use, and also eye-hand coordination. So it is important for us to see that we work much more on increasing the range of motion, increasing in-hand manipulation, and the different fine motor skills in his hands, and having the different grasp patterns that he can actually use. So that's why you'll find us doing much more of the different exercises. You can do the full handshake to see that you completely release all these flexed fingers, so that we can have that functional hand position. So this is what we want to achieve with Jojo. However, with the different techniques and therapy exercises that we're doing, we see that we can get there. So we can start with the handshake. We usually start with the handshake, then move down to the full flexion of the fingers, get them back up. I think you can hear the creptus sound. Jojo, don't be scared. So we do multiple reps of that, and then also move finger by finger to see how much you can help him. However, there's been we're still looking at providing a splint for him to see if we can have a wrist cock-up splint to fully have that functional hand position, and how effective it will be after the outcome of the exercise that we've been doing with him. Yes. So I think I've taken you so far through the joint range of motion and the different exercises that we do. So away from that, we also do much more of active weight bearing, and rather weight bearing in both standing and kneeling position. So we usually start with Jojo. So usually start with light weight bearing, both on both of his knees. Are you comfortable? All right. So when you put him both on his knees, then you're able to lift up one leg to see how much he can. So we also do that weight bearing. So we do in this position, make sure that the ankle is fully touching the ground, is fully touching the mat. So Jojo, make sure your foot is down and in front. Good boy. Now look up, look up. So fully engaging him in this weight bearing position on his knees. We start with one knee at a time, but we're going to do for both knees. So we do this on one side. The same exercise we've done here is the same exercise we do for this other limb as well. Yes. So away from that active, from that weight bearing, we have also been sitting him in a cross-leg position, just like you had seen earlier, to see that we achieve functional sitting position instead of having him sit in a W position. So most of these children with cerebral palsy, you find that parents don't usually mind the sitting posture, but it is important for these children to be sat much more in a cross-leg positioning. It helps them so much, and also helps us prevent pressure sores, and also helps us prevent the different complications that come with children sitting in a W position. Yes. The other challenge, Jojo, you can sit now. Let's sit. I want to sit properly. So just like you can see, the remote control with Jojo is not at its best because of the saliva drilling that is continuous. However, with the different oral motor exercises that we engage in, seeing that we do the oral massage, the oral stimulation, and then also engaging him in the oral exercises, it helps so much. The tongue push-ups, the lip closure activities, all these help us improve the motor control. So with Jojo, it's still a work in progress, and we're still pushing to see how much we can improve on the motor control. Not so? Yeah? You're going to stop drooling saliva very soon. Yes, so away from this, we have also been trying to work with him on the balance. We use our therapy ball to see that we work with vestibular stimulation, and also see how much we can engage him when it comes to balance training. So usually have him sat on the therapy ball to see how much we can work with his coordination. Jojo, you're not going to fall. Yes. So you release him, then he's able to fight and see how much balance he's going to achieve when on this therapy ball. Jojo, sit properly. So once he's here, we do the several vestibular techniques that we are trained with to see how much you can get this boy to balance and fully engage when it comes to his gait and also sitting balance, both dynamic and static. Jojo, how are you feeling? You feel like you're in air? Yes, be comfortable, be comfortable. So I'm going to leave you first play on that ball. Not so. If you can't balance, you're going to end up falling. If you can't balance, So I was just trying to take you through some of the. I'm trying to take you through some of the simple exercises that we usually do through our daily sessions. So away from the mat, we also engage in different other using our different other assistive devices. So we're also going to take you through and show you how much how we are able to use the other assistive devices to engage these children in the several activities that we have throughout the department. There are the standing frames, the parallel bars, and etc. Jojo, you come. So, I'm going to take you through some of the few of the assistive devices that we have here. We do have the wall bar. We usually use this for our children to improve strength and endurance. And then also the parallel bars. As you can see, Jojo is trying to get the parallel bars. Let me provide some little support here. Give me the hanky. You can hold there and put your other arm here. Lift the leg. Good. So this helps us with gait training for most of the children with difficulty with gait, and it's very effective, at least evidence-based. Away from the parallel bars, we do also have the other assistive devices. We do have the staircase, and then also the standing frame for active weight bearing. The staircases help us much more on balance with children with difficulty with balance, and then also the other different equipments that we might be having on the outdoor. Yes, however, so far that is how much our department is, plus the other different sensory materials, and then play materials. We have the sensory pathways, and then we also have the sensory tunnels, and the other different materials in this department so far. Casting materials available, and we're still trying to stock up and see how much we can get from our sensory room and the other equipments that are really needed. Yes. So yes, this is Jordan Katumba. He's an autistic child, and we've been working on sensory integration and seeing how much we can engage him in activities that would help him improve on his sensory modalities. So when it comes to Jordan, we've been using the sensory tunnel. Jordan, you get through, enter here. Jordan, enter here. Get through. Uncle is out this side. Come. Yay! He wants to go back. Yeah. Okay, go back. Enter inside. Let's go. I'm this side waiting for you. Yeah. Yeah, so we take them through this, and then also get them to the sensory pathways to make rounds. Let us walk. Slowly. So we take them through most of these sensory activities, and provide the different sensory integration therapy that we can, and these interventions help these children improve on their sensory processing challenges that they could be facing in one sector or the other. Lift one leg. Let's lift this leg up. Kwataawo. Naawo tulinye waggulu. Linnya waggulu. Situla n'ekigere ekirala. Linnya waggulu tugende ng'omukono gutambuza waggulu. Lift yourself up. Good girl. The same. Omukono ng'ogutambuza kuno. Then this one you put up. We lift the leg. Now lift yourself up. Lift this other leg. Let's go.